I'm Professor Peter Gaines. I'm an interventional radiologist at Sheffield, Hallum University in the UK. I'd like to present the 3-year data from the MIMICS-2 study. The MIMICS-2 study focused on the BioMimics 3D swirling flow stent. This stent is differentiated in its construct. The stent has a helical center line. This design is intended to impart non-planar curvature to the treated femoropopliteal segment. The reason for that will become clear in the next few slides. For those who have used this device, you will know that it is simple and accurate to place using a standard pin-pull system. In addition to having a helical center line that's designed to impart swirling flow, we know that following extensive benchtop testing that the stent has significant biomechanical improvements over a straight stent in what is well appreciated to be a hostile area in the distal superficial femoral artery. That benefit is well shown in the 0% stent fracture rate throughout the MIMICS-2 study. Blood flow around the body is well known to be laminar, but in fact it's more complex than that. Within the aorta and proximal branch vessels, the blood flow has a helical nature and is referred to as swirling flow. That swirling flow increases the wall shear stress on the endothelial cells. Wall shear stress can conceptually be thought of as the velocity of blood acting against the endothelial cell. High wall shear stress is a natural way of protecting against atherosclerosis, and indeed it is possible to map the generation of atherosclerosis around the body to areas of low wall shear. In particular, I think about the carotid bulb and the superficial femoral artery. In addition to protecting against atherosclerosis, high wall shear protects against intimal thickening. When that intimal thickening becomes profuse, then that results in restenosis. And indeed, the increased wall shear stress has been shown to have an antiproliferative effect after stenting. That effect is independent of the need for a drug. Within the superficial femoral artery, it is possible to demonstrate the generation of swirling flow using computational fluid dynamic modeling. On the left is a patient who's received a straight live stent, and you'll see that this modeling nicely demonstrates laminar flow. On the right, a separate patient has been treated with the BioMimics 3D stent. You can see clearly that the stent has deformed the artery into a helical contour and that the blood flow is now swirling, and you would expect a high wall shear. The first demonstration in humans following successful studies in animals was the MIMICS randomized controls trial. This was performed in Germany, where 76 patients were randomized 2-to-1 to receive either the BioMimics 3D stent or a straight nitinol stent in the superficial femoral artery. This study indeed was the first randomized trial against 2 separate stents in the superficial femoral artery. The trial had an independent core lab that adjudicated ultrasound, angiography, and plain X-rays. At 24 months, there was a clear benefit in primary patency in favor of those patients receiving BioMimics 3D stent. 72% were patent compared to 55% who received the straight stent. In addition, freedom from clinically driven target lesion revascularization between 12 and 24 months, when that benefit of swirling flow might be expected to be seen, was indeed beneficial for those patients receiving the BioMimics 3D stent. Within that time period, only 9% of patients required a clinically driven TLR, compared to 24% of patients who received the straight stent. This then was the first clinical proof supporting the durable outcome arising from the implantation of a BiMimics-3D stent compared to a straight nitinol stent. The continuation of the MIMICS clinical program led to the development of the MIMICS-2 study, whose data I'll present next. The company have extended their clinical program out to a registry within Europe and one intended to start soon within the USA. So far, over 1,750 patients have received the stent within the clinical program. The MIMICS-2 study evaluated the safety and effectiveness of the BiMimics-3D stent system in the femoral popliteal artery of patients with symptomatic peripheral artery disease. The study had an independent core lab adjudicating ultrasound, angiography, and X-rays, and an independent clinical event committee. The safety endpoint was a composite of death, major amputation, and clinically driven TLR through 30 days. The primary effectiveness endpoint was primary patency at 12 months. Follow-up was extended out to 3 years. There were 43 investigational sites enrolling 271 subjects, the majority of these being in the United States. Principal investigators were Tim Sullivan in the US, Thomas Zeller in Germany, and Masato Nakamura in Japan. At baseline, all patients had de novo lesions. The vast majority occurred in the mid and distal SFA, and the lesion length was a mean of 81.2 millimeters, longer than in the original randomized trial. 30% had total occlusions, and nearly half the patients had moderate to severe calcification. In accord with the protocol, the majority of patients had one or more patent tibial artery runoff. Most patients had only one stent implanted, although 1 in 8 patients had 2 stents. Stented length was 112 millimeters. Device success was 100%. Technical success was 100%. The primary safety endpoint at 99.6% was clearly achieved in comparison to the Viva physician's performance goal of greater than 88%. The primary effectiveness endpoint at 73.1% with a lower 95% confidence interval of 67.3% was again achieved when compared to the Viva physician's performance goal of greater than 66%. It should be noted also that this was done using a challenging definition of patency, whereby occlusion was defined as greater than a PSVR of 2. This presentation focuses on outcome out to 3 years. Freedom from clinically driven TLR at 3 years was an excellent 81%. And of note, there is little change in the outcome between 1 year and 3 years. This is in accord with that finding within the smaller randomized trial. To delve deeper into what might affect clinically driven TLR, lesion calcification was stratified between non-mild and moderate and severe. And interestingly, increasing calcification did not affect the outcome out to 3 years. Similarly, lesion complexity was divided between total occlusions and stenosis. And again, that increased lesion complexity did not have any effect on outcome out to 3 years. Neither did lesion length. Patients were separated into 3 groups, less than 65 millimeters, 65 to 100 millimeters, and greater than 100 millimeters. And again, those excellent CD-TLR outcomes were maintained out to 3 years, irrespective of lesion length. The anti-proliferative effect of elevating raw shear stress is compared on this slide against paclitaxel-eluting stents, and it can be seen that the outcomes are indeed comparable. The data have also been compared to Supera. Again, outcomes are comparable despite more challenging lesions and without the need for aggressive, extensive lesion preparation. MIMICS-2 produces reproducible, rigorous, high-quality data from 3 continents. 81% freedom from clinically driven TLR to 3 years is an excellent outcome. That outcome is comparable to drug-coated balloons, drug-eluting stents, and the Superior device, despite more challenging lesions and without the need for aggressive lesion preparation. The biomechanical excellence of this stent can be shown from a 0% stent fracture rate through the study to 3 years. In conclusion then, the BioMimics 3D stent reduces the burden of reintervention both for the patient and, importantly, for healthcare systems. Thank you.